Hi all, welcome to Facebook Live. Today we are going to discuss on the topic awareness towards sinusitis. Here are with us Dr. Sharif, consultant for ENT at Citizen Specialty Hospital, Nalaganda, Hyderabad.
Good evening. I'm Dr. Sharif. I've been working in Citizen Hospital for the last 5 years. Prior to that, I was working in Continent Hospital, and prior to that, I was working in UK for 10 years. My interest includes endoscopic sinus surgery, balloon sinuplasty, which involves the sinuses. In regarding the ear, endoscopic ear surgery, microscopic ear surgery. In the throat, we do sleep apnea surgeries and routine surgeries like adenoids, tonsillectomies. In the neck, I also operate on parotid glands, submandibular glands, or thyroid glands.
So first of all, I would like to ask what are sinuses and why do we have them?
Sinuses are nothing but air-filled cavities, air-filled balloons around our eyes. There are 4 of them each side. 2 above the eyes, 2 between the eyes, 2 below the eyes, 2 behind the eyes. The function of them is to protect the internal organs like brain and the eyes. They also function as they will make the skull more lighter rather than heavier, because if they are filled with bone or with liquid, the skull is going to weigh more than what it is now.
So secondly, who is at more risk for sinusitis?
Sinusitis is nothing but common cold. So I don't think one should worry about a sinusitis term. However, who is more at risk of this is people who smoke, who are more at risk of pollution, who are exposed to the pollution, either at work or in the traffic. Those people who also have structural issues. For example, somebody has a bent bone in the nose or polyps in the nose, or sometimes children who have large adenoids. Adenoids are nothing but like what we see in tonsils in the throat. Similar to that, we have what is called as adenoids, which are there in the back of the nose. If they grow bigger, they are likely to develop sinusitis in children. And there are certain immunological conditions which are make it causes few changes in the nasal cavity, which will make them more prone to sinusitis. Of course, people who have diabetes or dental problems are also more at risk of this.
So how does a person get sinus infection?
Sinus infection can come to anyone when there is a blocked nose. Blocked nose can be of any reason. It could be either allergies, because of which there is excessive sneezing, runny nose, blocked nose, or there are structural issues like I was talking earlier, bent bone in the nose, nasal polyps, or in children who have large adenoids, which is causing the blockage in the nose, or someone who can't or doesn't know how to blow their nose. Now, whenever this happens, whenever the nasal blockage happens, there is collection of the nasal secretions inside the nose. There is a fluid that constantly has some moisture in the nose. It keeps collecting. And when it collects and does not go out, it leads to a secondary infection by bacteria. And this will in turn lead to sinusitis.
What are the common symptoms for sinusitis?
There are 2 types of sinusitis. One is acute sinusitis. Second one is a chronic sinusitis. Acute means something that happens rapidly, which presents in a day or 2. Chronic means something that is ongoing for months or years. Now, the acute sinusitis typically presents like cold. That is, they have a blocked nose, stuffy nose. When they blow their nose, there are secretions that are coming either yellow or green in color. They have cough. They have sputum coming from the throat. They often have ear pain. They have headache and ear blockage. Now, along with that, usually they may or may not have some fever or body pains. This is how an acute sinusitis presents, which is almost similar to cold. Coming to chronic sinusitis, now in chronic sinusitis, which is going on for a good number of months, the patients do not have all these symptoms. Patients will simply have something like a cough or a throat irritation or something like a ear blockage. So they will not have great amount of nasal secretions, fever, headache. These are usually not present. Now, often I see patients who are told that they have sinus trouble when they have none of the cold symptoms. What I want you to remember is, by and large, you will not have sinusitis unless you have symptoms of cold, which means if a person doesn't have any issues related to the nose, it is unlikely that the headaches or anything else are related to sinusitis.
Doctor, is sinusitis hereditary?
By and large, sinusitis is not hereditary. It is usually acquired. There are very rare conditions in which sinusitis can present in families, but by and large, it is not hereditary. It is usually an acquired infection. That means that either smoking, pollution, or other factors in the nose, not keeping a nasal hygiene properly. These are the reasons why one would get sinusitis, rather than something as their parents would have, their grandparents would have. So it is not something that runs in the family or presents as hereditary.
Doctor, can one get infected with sinusitis at any age?
Yes, sinusitis can affect any age group, although there are certain age groups which are more prone. For example, the middle age, that is the age between, I would say, something around 25 to 45, 50. This is an age group that we commonly see here as most affected population. Although we do see large number of young people being affected by it, and elderly population, especially who have diabetes, being affected by the sinusitis often. However, the majority of the time it is between 25 to 45 years age group.
Doctor, how would the person know whether it's affected by sinusitis or allergic rhinitis?
It's a good question. The reason being, often I come across patients who think that they have sinusitis or sinus-related problem, whereas all the time they would have had allergy. Now, for a common person to understand, if there is a runny nose, sneezing, itching in the eyes, itching in the throat, which comes and goes with the seasons, this is nothing but allergy. This not to be confused as sinusitis. Sinusitis, as I was telling earlier, it is more symptoms of cold, in the sense that they have fever, body pains, sputum which is yellow or green, cough, pain in the teeth, pain across the face, which is lasting only 4-5 days usually, and it has not much of a bearing with the season. So my request to the general public would be, when you speak to a doctor, present your problem in a very simple terms. When you start talking about, doctor, I have sinusitis, perhaps there are a group of doctors who would be sidetracked, assuming that you have sinusitis. Rather than that, if you present as, I have a blocked nose, I have a runny nose, I have sneezing, or whatever the problem is, put it across in the simple terms, that would make the diagnosis, to come to a diagnosis pretty easier. Yeah.
Doctor, what are the treatments available for sinusitis?
Sinusitis, majority of the time, is treated with medicines. Majority of the time. Now, what medicines do we use? It would depend upon what we find when we examine the nose. Sometimes with the help of radiological investigations like CT scan. However, majority of the time, it is treated by antibiotics if necessary, and appropriate antibiotics obviously, and very importantly, a nasal decongestants. Nasal decongestants like Otrivin or Nasavion drops, or majority of the time we also use what is called as nasal steroid sprays. Now, these are used only for up to 5 to 10 days, and they are completely safe to be used. I'm often asked by the patients, nasal steroid sprays, the word steroid really triggers a bit of anxiety in the patients. But let me reassure you that there are number of studies, extensive amount of data which is present across the world about the role of nasal steroid spray, especially in the sinusitis. They are completely safe, including in pregnant women and lactating mothers. They are not absorbed into bloods. It is almost like an ointment to apply on the hand, where you usually are not very concerned about ointments that you apply on the hand, whether they are getting into your blood. Similarly, the nasal steroid sprays that we give in sinusitis are they do not get into blood, and they can be used extremely safely, including from the age group of about the 2-year-old. Now coming to the surgical management. Now, yes, there are times wherein we would have to interfere surgically. Those conditions, I would say, out of 100 patients who come with sinusitis, I perhaps would operate on less than 10% of the patients. Now, when we operate is when there is a problem which is happening recurrently. Recurrently means 4 to 5 times a year, and it often requires antibiotics, nasal sprays, and it is affecting their work, or sleep, or their personal life. And if this pattern continues for 2 to 3 years, in spite of our best efforts, if they are frequently occurring, which when I say frequently, more than 4 to 5 times a year, then one would start to think about surgical intervention. Now, the surgical intervention has various types to do. By and large, it is currently as endoscopic sinus surgery, which means that we use some telescopic rods, small rods, which we put through the nose, and we correct whatever the abnormalities are there in the nose. For example, as I was talking earlier, there are times there is a bent bone in the nose which needs correction. There are times where there are polyps that needs to be removed. There are times where the adenoids need to be addressed. These things are done by various tools that we have. The recent technology is obviously making it more quicker, efficient, faster, many times without much loss of blood. So we also often are using what is called as balloon sinuplasty, which obviously is pretty painless too. Most of the sinus surgeries are generally painless. So pain is a least of the issues that come from the sinus surgery. Patients often have a bit of a bleeding from their nose, which can last up to 3 to 5 days. We have moved away from nasal packs. At earlier times, we used to stuff patients' nose with a dressing to stop bleeding. Now, these days, as I was talking about advanced technology, we are no longer doing that, because of which patients are pretty comfortable the next day following surgery. However, we ask them to take bed rest for about 4 to 5 days, because there is some amount of oozing or bleeding that you see from the nose for 3 to 4 days. There are various medicines we give for the first 1 week to reduce the swelling in the nose, to stop any infections, to reduce the bleeding. In about a week's time from the surgery, we usually clean the nose, and they are generally fit to resume their office duties. We do suggest the patients not to do any strenuous activities like taking up gym or jogging or any martial arts for up to a month. But after a month, by and large, most of the patients can do everything what they did before, although, of course, without obviously running into trouble of sinusitis frequently.
Doctor, what are the precautions to be taken to avoid recurrent sinusitis?
Sinusitis, the preventions are, first is not exposing ourselves to pollution, which is a major factor. We see a lot more sinusitis, upper respiratory tract infections in the places where there is more pollution. Secondly, extreme weather conditions. especially the colder conditions does trigger sinusitis, so you would want to avoid that. Dusty places, crowded places, which of course sometimes it is unavoidable, but if you are there, wearing a mask would help. Another very effective way of stopping this sinusitis coming frequently is a regular cleaning of the nose with water. As you would know, our Indian tradition in yoga, they used to do what is called as jalniti, which means that people used to clean their nose with either a little bottle that they have, or they would just sniff the water in the nose to clean up or rinse their nose. Now, this is proven to be scientifically a very effective way to stop recurrent sinus infections. So, and last but not least would be these nasal steroid sprays. We use it as a preventive method up to 3 months in patients who are frequently getting this problem. So, one is Jalniti, which is a traditional way to deal with that. The second would be a nasal steroid spray. If a patient does develop symptoms of cold, my suggestion would be just to take one of the antihistamines like Allegra, cetirizine, use some steam so that the nasal passages are open and clear, use some of the decongestant drops that are available over the counter, something like Otrivin, Nasevian. This by and large would help the nasal cavity to be free and air to pass through. Once the nasal airway is clear, often we will not land up into sinusitis.
Doctor, overall, what is your opinion towards sinusitis for our viewers?
My suggestion would be when you go to a doctor, tell your symptoms in a very non-scientific layman terms so that the doctor can understand your problem well. Second, sinusitis is not a dangerous disease. It is nothing but an extension of cold, so one need not worry about it. Every sinusitis doesn't require surgery. There are very less percentage of the people who require sinusitis surgery. In the right patient, with the right doctor, with the right equipment, sinusitis is very well controlled or treated, even if we have to do by surgery. Only the wrongly indicated surgery, for example, if someone ends up having a surgery for allergic problem, obviously they are not going to get better. Hence, there is at times a bad reputation that, when the sinus surgery is done, they come back again, which is not true. So it's very essential as to know to differentiate whether the problem is allergy or sinusitis, whether we have given enough amount of time to be treated medically. And of course, in the end of the day, if none of the medical options are working and we have tried it for a good amount of time, yes, that is the time to think about surgery, which is perfectly safe and it gives you excellent results if it is done in the right way.
Thank you so much, Doctor. This brings much awareness towards sinusitis as well as the major difference between sinusitis and allergic rhinitis.
Thank you.